So this is not Coca-Cola, where two people in the entire organization have the secret formula to Coke. It's everybody in the organization essentially has access to the information because they need it. They must have it in order to carry out, our operation.
This is a Security Weekly production. Security Weekly is a resource of Cyber Risk Alliance.
The Cybersecurity Collaborative, in conjunction with Cyber Reason, is proud to present CISO Stories. Each week, CISO Stories takes a deep dive on security leadership. The Cybersecurity Collaborative is a unique membership community enabling cybersecurity leaders to work together in a trusted environment. To learn more, visit securityweekly.com/CSC. I am your host, Todd Fitzgerald, and this week we welcome Erik Decker, CISO at Intermountain Healthcare, previously recorded while Erik was CISO at University of Chicago Medicine.
So I came into security through IT engineering. I was actually a networking engineer way early on. Actually, before that, I was even in support. So doing the traditional IT route. And right around the .com era, post.com era was when security was sort of becoming something new and interesting. And in my role as a network engineer, I was just super interested in this concept of understanding how IT works and then understanding how to break it and make it do something different than it was intended to be implemented. So that sort of that thought exercise, associated to that really intrigued me. And that's mostly what got me hooked on this whole business. And so, the whole idea of we've got technology and technology is supposed to work in a very specific way. And there's all these unintended consequences associated to it. And so how do you push the technology into a different direction to make it do something you had never, originally intended it to do? So that's ultimately it. When my first full job in security was when I moved up to Chicago in higher education. And I was doing security engineering, security analysis work. And then from there, I moved over to New York, Columbia University Medical Center in New York. And that's how I got into healthcare, cybersecurity, and management actually as well. It's an interesting challenge. I mean, it's certainly far more than just, when we typically think about security, historically, it's been about data security, data privacy, data protection. And although still very much paramount in this field, and we spend a lot of time and effort on that, there's the whole life safety aspect of this that is they're very unique in the healthcare industry, which I think is a very interesting challenge and a very serious challenge.
Yeah, and you wrote an excellent piece for the book CISO Compass, Navigating Cybersecurity Leadership Challenges with Insights from Pioneers. And your piece was about healthcare cybersecurity. And one of the things that you noted in the beginning of that article was just how ransomware has really had a significant impact. And you talk about the life safety issue with that. So, when did ransomware really start to come to light with healthcare security in a big way?
Yeah, so ransomware has been an issue. It's not new in the sense of there is malware that exists that can, encrypt files and do bad things. But what happened was in about 2015 or 2016 was when organized crime really got behind leveraging that tool in a far more disruptive and destructive type of manner. And rather than just, worried about onesie-twosie computers, it was more about the full attack chain and leveraging that as a weaponized tool to push through your environment and lock up your environment. So, ultimately, that was about 2015 or 16 when the threat actors changed significantly and their sophistication changed significantly. And that's when you start also seeing the first hits in the news. I mean, I think probably everybody remembers the Hollywood Presbyterian case, which was, I think, one of the big first ones where they were locked up for a couple of weeks, I believe, and, effectively shut down the whole healthcare system. And when you don't have your technology, your EMR, your ERP, your endpoints in order to run your clinical workflows and support the actual care that's happening, your volumes come down to a screeching halt. And if your volumes come down to a screeching halt, you can't care for patients, and then that is the life safety impact that happens just right then and there, in addition to the business impact that occurs.
Do you think that hospitals and healthcare providers were paying much more attention to security since those types of events than, because we've had HIPAA around for 15 years. Do you think there was a greater focus on it then?
Yeah, definitely in 2015, 16 was when healthcare systems started waking up significantly. And I think boards started, getting very nervous about this because they realized, not to downplay the data protection and the data privacy issues, but a loss of data doesn't directly cause a business to be disrupted and to come to a screeching halt. It certainly has regulatory fines, it certainly has reputational fines, it certainly has all sorts of other indirect issues. And of course, it has the impacts to your patients' privacy. And those are serious. And, healthcare systems were nervous about that. But then this threat actor came out that said, okay, now we can shut down your system. In addition to stealing your data, we'll shut down your system unless you pay us a ransom, or maybe not even pay a ransom if they just want to cause some sort of disruption. That really, really scared the bejesus out of a lot of people. Certainly within my own institution, my own institution has been serious about this for quite some time. But I saw the tenor change, in about 2016, with everybody reading about these attacks and getting very nervous about, could it happen to us? And what would happen if we got hit with some large scale attack like this?
Mm-hmm. And what sort of things did that prompt you and other healthcare organizations to put in place, knowing that there was this ransomware threat out there?
Yeah, I think so. A lot of what we do in cyber, the mechanics of it, helps protect us against these types of threats. If you think about it, the way a ransomware attack happens or any other type of disruption attack happens, it's all starts the same way, the attack lifecycle. It's just the outcome that's different. Is the outcome going to be a data exfiltration? Is it going to be locking up your systems? Is it going to be, causing an impact to a medical device and causing some direct harm to a patient? So the channel of it is similar. So what I did was I reframed the conversation, because this is a hard concept for the non-techies to understand. And when I started early on working with the board, I described the risks, the cyber risks to them in 5 facets. I talked about the data exfiltration issue, which we all know and love and have known for a long time. Talked about people inside our organization making mistakes and causing some sort of problem because they release data incorrectly, and that's also a data issue. I brought in the ransomware problem, the disruption and extortion of our systems, the life safety issue associated to medical devices and the security of those medical devices, and leveraging M&A activity. And as we buy more health systems and practices, we increase our footprint and we increase our complexity, and that comes with its own intrinsic vulnerabilities associated to it and its own risks. So when I described it in those terms, and I benchmark all of that back to the NIST cybersecurity framework and use that as a maturity model, effectively, so I could demonstrate to them how we progress over time and how those investments that they make within security turn into more maturity, which turns into more mitigation capability of those 5 risks. That reframing of the conversation really significantly helped them get it. And it helped make the problem a little less scary, although it's still scary, but it was tangible, by framing it that way.
And I like how you position the looking at the CISO as the risk advisor, and when you're having these committee meetings with the senior executives, that somebody else should be the chair, because you're there as the risk advisor, and you really wanted them to own that risk.
Yep. Yes, absolutely. That was early on. So I joined the organization in 2014, and one of the first things that I did, and I'm also the first CISO for the organization. So one of the first things I did when I got there was worked on establishing governance. And we're an academic medical center, so that means that we have a hospital, which is where I'm part of, and we also have a university. And the School of Medicine of the university is attached to the hospital. And so you've got these two organizations that sort of orbit around one another like binary stars. And then sometimes they work and sometimes they challenge each other.
Like all organizations, right?
Exactly. But at the head of the organization is the CEO, who is actually over both, at the end of the day. And there's different missions, right? So on the hospital side, it's more about care. It's more about, community give back, and the mission of healthcare. And on the university side, it's research, education, and care. So the first thing that I did when I got there was started, sitting down with all the various stakeholders, the executives of both of these institutions, and started, facilitating how are we going to govern this. There's risks all over the place. There's decisions that need to be made. And this is not something that me, Erik Decker, can do by myself. There's a lot that we can do within the security office at the tactical level, but I need the help of the institution to drive it, to raise the profile of the program and make sure everybody understands what needs to happen, and, secure funding, resources, et cetera. So when I gave the pitch to the CEO, after doing my rounds and getting the assessment done, I threw out the governance structure that we have in place today. And, and I asked him, I said, we need a chair for this. And that chair should not be me. It needs to be somebody who's on the business side and who's an executive. And he said to me, he said, well, I'm not sure who could chair this other than me, because there's nobody else that straddles both sides of the fence in the same way that I do. I'm not going to have to do any work, am I? And I said, no. I will do all the work. I just need you to bring people to the table. And that's fantastic. And so I was not expecting that at all. I was expecting, the CFO or the COO or somebody else to be charged with it. But he saw the importance for what it is, and the uniqueness of AMCs in particular, with the straddling of both sides of the institutions. And it's been successful ever since then. I mean, we've been running strong for the last 6 years, same cadence that we have since day one.
Well, you must be doing something right.
I hope so. There's things I do wrong, but
The article this podcast is based upon can be viewed in the best-selling cybersecurity leadership book, CISO Compass, Navigating Cybersecurity Leadership Challenges with Insights from Pioneers, available at Amazon.com and other booksellers.
Okay, we all do.
I also liked how you talked about the, that security really needs to be built into the clinical systems, and you really need that business knowledge to be able to do that, and that it was their job to change the policy, and the security department could inform what those IT changes should be, but ultimately it really bubbles up to them to help with what are those processes that help deliver the healthcare.
Yeah, I mean, exactly. I mean, I'm not a clinician. I'm not an MD. What might seem very easy for me could actually, and I've run into this several times, some very simple security control could actually cause a huge impact on a workflow that you had no idea about. And if you do that to the business and you introduce this hoop that they have to jump through that doesn't nominally increase or decrease a risk that you're working through, ultimately then what you're doing is training the institution to bypass you in some way, shape, or form. And we rather have everybody coming to us and then working through what the issues are and even accepting risks and knowingly doing that, through exception processes and such, than having people just sort of go off on their own and do whatever they're going to do, because that's how it's the unknown unknowns, right? That comes and bites you, eventually. And hopefully we can advise the institutions properly when we're informed about that. So that trust, is really important.
So did you ever have an idea that it sounds like you may have had a few, that where, hey, this would be a great security thing to do, but then as you talked it through with your business, wasn't maybe not
yeah,
such a good idea?
I'm trying to think of an example of one. I know that's happened. Definitely it's happened. I mean, it's not super impactful, but right now we're in the middle of the pandemic, and a majority of the workforce is working from home, and we had to very quickly stand up a telemedicine capability. And the Office for Civil Rights issued a notice of enforcement, discretion of enforcement. So essentially, they said, though HIPAA still applies, we're not going to enforce HIPAA, during this time frame, as it relates to telemedicine. And so, the institution hears that, and everybody gets very creative very quickly, and so suddenly there's all these like telemedicine platforms that are out there that everybody wants to be using, and despite the fact that our institution is trying to, push down a particular pathway. So, I held the party line, I tried to, there's a few physicians that were working off of a couple of different platforms. Again, they were informing us of this, and I tried to, say like, no, we need to be using this, not that, please work over here. And turned out that a couple of weeks into it, I ultimately, changed course. The other platform is more usable, user friendly, et cetera, et cetera. They liked it a lot better. They got what they wanted to get, and c'est la vie. There we go. It's just what you thought was a one perspective turns into a different perspective. So, but that happens all the time. I mean, it's not.
I mean, that's really a great example of really listening to your business, and you mentioned a key word there, usability for them.
Yeah.
It's just as important. Otherwise, they're going to be using something else that you don't know about that is much here. So and you're balancing out that risk and also looking at, making sure it's not just about the regulation, right? It's also about what is the real risk. So I think that's an excellent example. One thing you mentioned was just the fact of so many people are involved in healthcare, and I know several years back I had to go to the emergency room because I was having some heart palpitations after I was exercising. It turned out to be nothing at the time, but what amazed me was all these people that were coming in and out of the room, and it was, and I started, I was mentally like counting up the number of people, and I came with that same kind of number. I think there was like 100 people that were I mean, and then there were people coming in that were residents that were trying to learn, and then it's like, how do you manage the healthcare of somebody when so many people are touching your records in the healthcare setting, and then beyond that, all the infrastructure pieces?
Right.
It's got to be quite a challenge.
So, I mean, I've said this a lot. Healthcare is a unique industry in the sense that we have this very sensitive information about you, which is necessary, obviously, to provide you with care. And our workforce, about, good 60 to 80% of our workforce needs to have access to that information. So this is not Coca-Cola, where two people in the entire organization have the secret formula to Coke. It's everybody in the organization essentially has access to the information because they need it. They must have it in order to carry out, our operation, in order to carry out care, in order to carry out payments, or carry out, just other operational quality improvement, research. All of this, obviously ties into the data itself. So it's ubiquitous. I mean, it's in a lot of places. It's, your traditional strategies of trying to say, like, you're going to have just a core set of systems in one area, locked down, Fort Knox kind of style. It doesn't really work because you have the information flows, all throughout the ecosystem. So, how do you protect it? I mean, you have to take, again, it all comes back down to risk, as at the end of the day. And I'll start with just those 5 risks that I talked about at the beginning, and then thinking about how these threat vectors come in and out of your environment. So what are the different types of threats? You can probably break that up into 4: internal and external, and malicious and accidental. At the end of the day, and it's two coins, two sides of the same coin. And so then you just applying that sort of thinking, that modeling of how those threats act, how they interact with the risks, and then how your frameworks sort of sit on top of that. Understanding where your data flows throughout your organization, getting good inventories of your systems and assets and such, having good oversight and governance around what's going on with all these with all your systems, and that can mean like high level oversight, where your big executives governance meetings where you're setting direction and pointing the ship. It also, but at the same token, you've got to get deep into the business practices and processes so you can attach yourself to them. So working with supply chain is a fantastic example. So anytime new technology comes into your environment, you want supply chain to sit there and inform you on that, because they're the pipeline. That's where the money is going in and out of the door. And so if you can attach yourself to supply chain and work through those processes, you can get a bead on what's actually happening inside your institution. You can direct as it happens in an operational way. I could keep going on and on. That's just one other example. There's other operational processes within IT that are important, sitting in with your change management processes, sitting in with your portfolio governance processes. So what new projects are coming up and new adjustments are happening. Having your security operations center, in place, your incident response, your DLP, we just start going through the list of stuff. Sure. But all of that, when you think about it, like I don't think about it as like having zones within my organization. I think of it as the full organization, and what are those processes that run throughout the entirety of it, and then figuring out how we attach ourselves into it and provide the guidance and direction as necessary.
That really makes a lot of sense. I think that's a really, really good way to look at it, and thinking about, as you talked earlier about what those outcomes are, and then how do we actually achieve those outcomes. Well, yeah. Erik, it's been a pleasure talking with you today, and I really want to thank you for sharing your insights in the CISO Compass book, as well as just for all that you do within the industry itself. Do you have any other last minute comments that you'd like to share?
Well, anybody who's interested in healthcare cybersecurity, you should check out 2 publications now. The Healthcare Industry Cybersecurity Practices, which was a pretty voluminous guide that a task group under the Healthcare Sector Coordinating Council and federal government put together. And we call it HICCUP, HICP. And then there's a new one that we just got done releasing called the Health Industry Cybersecurity Tactical Crisis Response Guide. So HIC-TICKER is the fun little acronym on that one. But that's, in this case that we are in right now, where we are caring for patients in the middle of a pandemic. We are shifting our organizations to do working remotely and, moving into a telemedicine type of capacity very quickly. And healthcare systems do not move this fast. We have all been forced to move this fast. This guide is really designed to help you understand how to manage a crisis, when you're in the middle of it. And you may or may not have some, pre-existing plans in place. And so it just sort of gives you a punch list of things to think about.
Well,
so
I really look forward to reading that. I saw the earlier versions of HIPAA and some of the later ones, and it's a great piece of work. And thanks for your contribution to the industry.
Yeah, thank you, Todd.
Thanks a lot, Erik.
Cybereason is the champion for today's defenders, providing an endpoint security platform to prevent, detect, and respond to malicious operations on computers, mobile devices, servers, and the cloud. Cybereason. End cyber attacks from endpoints to the enterprise to everywhere. Learn more at cybereason.com/CISO stories.